Hello and welcome to your monthly update from the COVIDENCE UK study. My name's Adrian Martineau. I'm the Chief Investigator based here at Queen Mary University of London. And with me today is Giulia Vivaldi, the lead statistician on COVIDENCE UK. And she's going to share with us the latest results of her analysis, looking at time since vaccination and severity of disease. Giulia, over to you.
Thanks, Adrian. So in a previous webinar, we looked at results from a large study published in The Lancet earlier this year that describes how under-vaccination is associated with increased risk of severe COVID-19 outcomes, such as hospitalization and death. In today's webinar, we're going to address a similar question in the COVIDENCE UK cohort and look at whether time since last vaccination affects the severity and duration of COVID-19 symptoms in the community, with a particular focus on groups currently not eligible for frequent booster vaccinations. Anecdotally, some COVIDENCE UK participants have said that their latest bout of COVID-19 has felt worse than ones they had when they were more recently vaccinated. So we were interested to see whether time since vaccination might be contributing to this effect. Now, most of us will have received a booster vaccine in the winter of 2021 as a response to the Omicron variant. And for many of us, that will have been the last vaccine we received more than 2 years ago. But some groups are being offered more frequent vaccines every 6 to 12 months. These are generally people who are at increased risk of severe outcomes if they get COVID-19, such as older people or those with health problems, but also people who have frequent contact with vulnerable people. And here we can see the groups who have been eligible for additional annual boosters according to their age, health conditions, or contact with vulnerable people. For health conditions, the JCVI, the Joint Committee on Vaccination and Immunisation, has defined a clinical risk group that includes a wide range of conditions such as diabetes, chronic heart disease, neurological disease, and some types of respiratory disease, and also includes the immunosuppressed. Now, most of the groups shown here have been offered an additional COVID booster each autumn. However, some groups have also been offered them in the spring, such as people aged 75 years and older, immunosuppressed people, and care home residents, meaning they will have been receiving boosters every 6 months. On the other hand, some groups are no longer being offered additional boosters, such as adults younger than 65 years of age. And so we were interested to see what the effect of either annual or 6-monthly vaccination might be, depending on people's current eligibility, on the severity and duration of symptoms that they experience during COVID-19. And in this webinar, we're going to present our findings for the different age groups. So we restricted this analysis to people who had received at least 1 booster vaccine and had since tested positive for COVID, giving us approximately 7,400 participants. And in these participants, we looked at 3 outcomes: self-reported symptom severity, symptom duration, and changes to their health-related quality of life in the month after infection. And we adjusted for various factors that we believed could be associated with both time since vaccination and COVID-19 severity, such as age, health conditions, frontline worker status, among others. And we also ran sensitivity analyses in people who had reported 2 post-booster infections, adjusting for their previous infection severity. So for symptom severity, we looked at the odds of reporting being very unwell, which means being unable to do all usual activities and having to go to bed during the day. And this was significantly higher in those participants who hadn't been vaccinated in the previous year versus those who had. When we restricted the analysis to age groups no longer receiving yearly vaccinations, we found similar results. Now, the result in people younger than 50 is borderline significant, but this is likely due to a small sample size in our cohort. Now, people aged 65 to 75 are currently being offered yearly vaccinations. So instead, we looked at whether having had the vaccine in the last 6 months might affect symptom severity. And we found, again, that participants vaccinated more than 6 months earlier had significantly higher odds of reporting being very unwell. When we looked at symptom duration, we found few significant differences according to time since vaccination. In fact, the only group in which we observed it initially was in people aged 65 to 75 years of age, who were no longer eligible for the spring boosters. The plot shown here essentially shows the time to recovery in those participants according to their vaccination status. And the median time to recovery, shown at 0.5 on the vertical axis, is about 2 days longer in people who hadn't had a vaccine in the past 6 months. Now, it's worth noting that when we were able to adjust for the symptom severity of a previous post-booster infection, we started to see significant results in other age groups as well. However, the increase in symptom duration remained small. Finally, we looked at health-related quality of life as measured by the EQ5D, which considers 5 different dimensions of quality of life. We combined these 5 dimensions and compared values before infection to the month after infection. However, we didn't observe any differences in any of the age groups. So in conclusion, we found that recent vaccination is associated with a reduced likelihood of feeling very unwell during COVID-19. Recent vaccination also seems to be associated with a slightly shorter symptom duration, particularly in people older than 65 years of age. However, we found no association between recent vaccination and changes to health-related quality of life during the acute infection. The next steps will be to look more closely at different groups of people, particularly people with asthma. Currently, only people with poorly controlled asthma are eligible for repeated boosters, but we want to see whether people with asthma who haven't experienced recent asthma exacerbations might also benefit from having more frequent vaccinations.
Thanks very much, Giulia, for a typically lucid presentation, and we look forward to hearing results of your ongoing analyses in those of our participants who have asthma in a future webinar. So thank you also to all of you who continue to complete your monthly questionnaires. So you can see we're continuing to make good use of your data, and I look forward to seeing you next month. From all of us here at COVIDENCE UK, goodbye.